afternoon, Dr. Garcia-Rios.
Hello.
Is it okay if I call you Dr. G?
You can call me Dr. G.
Okay, wonderful. Welcome to In Good Health with McLaren Macomb.
Oh, thank you. I'm glad to be here.
So, you're a family medicine doctor.
Absolutely.
Sounds like that covers an awful lot.
It does.
Can you tell us a little bit about it?
Well, family practice is basically that. We do a little bit of this, we do a little bit of that. Cover all specialties. As far as what I do, you manage children. We do peds. I do peds. Through adult medicine, geriatrics, we do women's health. The nice thing about family practice is that we're kind of the gatekeepers. Mm-hmm. So somebody comes in, and if it's something that maybe they're not responding to treatments, specifically what it might be, then we have the opportunity to refer out to specialists. So if we have somebody that comes in and I do an EKG, and there's something not right on the EKG, they might need further testing, might refer them to a cardiologist. Mm-hmm. Same thing with get somebody that comes in and they have an orthopedic problem, they have a fracture. We fix them up, splint them, and then we'll refer them so that they can get properly treated, whether they need surgery or anything else.
Okay, so you're the first line of defense in most cases?
Absolutely.
Okay.
We're the first ones that people come and see.
Okay. And so technically, your office could see someone from birth to the end of life. Is that correct?
The great thing about family practice is, especially in my case, since I'm new, you build a practice. You have families that come in. You see the husbands, you see the wives, you see the kids. Mm-hmm. You watch them grow, and you kind of grow with them. So it's kind of like a big family. Mm-hmm. So then as time goes and as you see them, it's almost like making friends. You know who they are. You know what their issues are, and you understand them better each time they come in to see you. Mm-hmm. So you have a very personal a
great relationship. Yeah.
Absolutely.
Mm-hmm. That's awesome. Now, this might be a difficult question because you deal with such a wide range of people and patients. Do you see things commonly in age groups of people? So do you treat children for any specific things more frequently than another issue, or senior citizens for something more than something else?
That's a really good question. And I'm sure you're well aware of this. You see it in the news, quite frankly, when you go out to eat or you go to a grocery store. Mm-hmm. Obesity is the big problem. Mm-hmm. And that's one of the biggest challenges. And you see it across the board. I got young kids that weigh more than I do. Mm. And how do they get that way? Trying to stop in the beginning, but it's something you're seeing all throughout all age groups. Mm-hmm. So it becomes a challenge.
Wow, and is that something that you deal with in office as well?
Yes.
Do you do nutrition management and those sort of things?
Absolutely.
Or? Okay.
Nutrition management, obviously my big thing is lifestyle changes. Lifestyle changes are the most important because you're not going to be successful unless you focus on lifestyle. Mm-hmm. And when we talk about diets, I hate the word diet because, quite frankly, there is no such thing. It's a lifestyle.
Right.
So, you watch what you eat. Moderation is the key. Mm-hmm. Too much of a good thing is bad, and you don't get enough exercise, and sets up the perfect recipe for, obesity and health problems down the road.
Is there a frequency that makes sense? Like, should people see you once a year, or how often should they come in?
It's another good question. Mm-hmm. So, part of being a family doctor is being a preventative health doctor.
Okay.
So if you can prevent the disease, that's the most important goal of what I do. Mm-hmm. I'm not the kind of doctor, I hate prescribing medicines. So if we can get to the point where somebody becomes a diabetic or somebody has high cholesterol or high blood pressure, that's great. So there are things that we do, such as we do physicals. It's recommended that a person comes in at least once a year for that, depending on their age group, because there's different periods in life where you start screening for certain things. Now they're screening for things like hypertension very early on in life, start screening for cholesterol, later on in life, and then so forth. And then as we get older, like such as for women, for example, when you turn 40, most doctors do mammograms. Mm-hmm. Do mammograms, and then as we get older, and those are screening tools just because the risks of certain things do go up with age, such as a colonoscopy at the age of 50. Just being sure that there's nothing there that raises any eyebrows that could be a problem. So if we identify those things, that, obviously that keeps the person in a state of mind of good health. So I would at least recommend every year a person should come in for a physical.
Okay. So should a person come in and see their family doctor only when they're not feeling well, or is there a way to come in to be proactive and preventative, a frequency that would lend itself toward that?
That's a very good question. So, the thing is that when it comes to people and patients, you know your body better than anybody else. So, if you feel that there's something not right, of course come to the doctor. We have a lot of people that come in, they get a little sore throat or something like that. It started, a day, should they come in for that? Probably viral. But, if they feel like there's something wrong, then yes, they should come in. I don't think there's no such thing as coming to the doctor as many times as he needed. And I think it just goes back on the patient. How do you feel? Do you feel like you need to be treated or seen?
Do you find that you have a greater frequency of patients coming in different times of year because of allergy season or cold season or things of that nature?
Oh, absolutely. Especially the autumn, winter, early spring. Flu season's big. It's been a bad year this year. Had a lot of people come in, and it seems to be a trend every single year. Very similar things. People come in, with colds and flu, seeing quite a bit of flu, sinus infections, and that seems to be a pattern. You can see all that stuff throughout the year, but it seems to decrease during the summertime. And then when spring comes, I get a lot of kids that come in wanting sports physicals because they're going to get ready to play sports. So it's different times of the year that people come in. And then as far as physicals go, that seems to be throughout the year.
Okay. Is it helpful from the doctor perspective to have patients coming in on a regular basis annually in their overall health picture?
Absolutely. It's continuity of care. You have a person that comes in, now we do a physical on them. They're 40. I'll use a lady, for example. We do all their preventative blood work. We check their things like their cholesterol, their thyroid, screening them for diabetes, checking their blood pressure, ordering all the necessary preventative tests. So, everything comes back, we review it, cholesterol slightly abnormal. So obviously when something comes back, there's always some kind of follow-up. What can we do at that time to make that person better? We're going to discuss things like lifestyle changes, what can we do about diets, calorie restrictions, and maybe have them come back in 6 months to check that. So it's all about continuity of care, because if something's wrong, we want to know if they're making improvements so that we can fix the condition, versus if the person doesn't come back. They come back, several years later, we know nothing what happened between that point in time. And, things could have changed. Maybe the person's health went downhill, and, if we don't have that continuity of care, then it would be very, very difficult to treat the patient.
Okay, and how many ailments do you see that go undetected? Where people don't have actual physical symptoms, but then upon doing a checkup, you find something. Does that happen frequently?
It happens, absolutely. Good example is, I have a patient that comes in and sees me for the first time. We do a physical. We do their blood work, their fasting blood work, and they have a fasting blood sugar of 300. Yet they don't have any symptoms, they feel fine. The person's a diabetic.
Wow.
Absolutely. So that's actually more common than people think.
Okay. So the key here is set a regular appointment, make sure you don't miss your appointments, and pay attention to your body.
Absolutely.
Listen to your body.
Absolutely.
Any other advice you'd give people
I tell
to
people,
maintain good health?
Especially in our society, there's so many good places to eat. There's so much processed food out there. And, I'm very, very big, especially when it comes to peds. And I counsel patients, because habits are formed very early on in life, such as diet. And, if you eat processed foods and you eat poorly, those are habits that stick with you throughout life. As far as part of the battle against obesity, targeting that very early on in life so that you can correct those behavioral patterns now, versus when you do become an adolescent or you become an adult. And now you have issues where you're overweight as a child, you're overweight as an adult, now you're higher risk of developing hypertension and diabetes and higher risk of developing heart disease later on in life. So, you know, that and being active. Being active is so crucial. And we are somewhat of a sedentary society. You know, and it's not just for people who don't exercise. There's a lot of people who work long hours, but they have desk jobs. It's like, how do you make the time to go exercise or be active? And those are all risk factors, and what can be done to correct those things. So, you know, that's one thing I counsel people. What are some things that you can do to make yourself more active, and what are things that you can do to watch your diet, as far as portions and calories, and as far as what you're consuming, because those all make a big difference as far as your overall health in the long run.
Thank you so much for your time, Dr. G.
Well, thank you very much for having me here.
Thanks for being here.
Make an appointment at mclaren.org/Macomb appointments.